Lovely. Well, thank you very much for having me here today, and I'm amazed at this event. It's fantastic to see so many people so interested in menopause. No, it's fantastic. I'm so impressed. To give up your Saturday to come and find out about menopause is amazing. So I have got quite a lot to say, so I will speak quite fast. So menopause definition, it is the cessation of menstrual periods. So estrogen and testosterone, we need those. It's very, very horrible that we don't, that happens at this time of life, and has many, many symptoms and physical changes that can happen throughout this time. And that time can change. It can be that it's been a medically induced menopause due to surgery. It can be just the normal menopause that can start anywhere from 40 up until sort of 55 onwards. And some people even get a much earlier menopause, which is, from 30s. We've seen some people, which is so difficult to even comprehend at that sort of age. Now, I'm going to talk about all of these sorts of things. So pelvic floor is going to be the first thing that I mention, and all the issues to do with the pelvic floor. Intimacy is something else that I think as us true Brits, we're not very good at talking about, but it's a really important part of our lives, and I think there's lots of things that can help. Bone health if I have time, and a lot about exercise. I don't know why that one came up as a separate. Oh, nothing's happening. What's happened to my slides? Oh, okay, so stress incontinence. Stress incontinence is when we cough, sneeze, laugh, lift, we get a downward pressure, increases the intra-abdominal pressure, and if the pelvic floor isn't on as equal to opposite, then we might get some leaking. So this can happen postnatally. Well, it can happen if you do a job with heavy lifting, but during the menopause, these symptoms often worsen. Am I pointing at the wrong spot? Okay, I can have the whole slide up actually. It should all come up as one slide actually. Thank you, that's perfect. So this is the stress incontinence. So this is a normal pressure, and this is when the pressure is too much from the top and we're not getting equal and opposite pressure at the bottom. This is about urgency. So this is running to the loo or going to the loo really frequently. So normal visiting the loo is 3 hourly. So if you're going to the loo more often than that, there's likely that there's some frequency there. Or if you're getting that sudden urge to go, that's a feeling of urgency. So I'm going to talk about that. And then in this corner down here, we have prolapse symptoms. So this is when either the uterus can drop, or we can get a bulge on the front wall of the vagina or the back wall of the vagina. And if you have a chance to look at these pictures a little bit more closely, you'll see that happening. Thank you. So bladder training. So this is all to do with urgency. So a lot of things that you can do. So if you're one of these people that has to run to the loo or goes more than 3 hourly, you might need to think about these things. So the first thing I ask my patients to do is to think about what they're drinking, because caffeine, fizzy drinks, fresh fruit juice and alcohol will all irritate that bladder lining. So if you can avoid those for a couple of months and then just see what happens to your bladder, give it an opportunity to calm down. The next thing is watching the amount you actually drink. So you should be drinking about 1.5 to 2 litres in a day. If you drink under 1.5 litres, your urine will be very strong, and that in turn can irritate the bladder lining. If you drink over 2 litres, then you will obviously be on the loo a little bit more often. And if it's really hot or you're doing lots of exercise, then obviously you need to drink a little bit more. But on average, that's what you're looking at. You're aiming to visit the loo 3 to 4 hourly. Don't think it's a good idea to leave it longer than that. We have a few patients who we do bladder training with, and they're very proud of themselves for leaving it 6 hours, but actually you then end up with an over-distended bladder, and we don't want the other end of the spectrum. So that's an overstretched muscle, which we see with a lot of nurses. You get the nurse's bladder, and that becomes a non-functioning bladder. Now we've got some deferment techniques. So if you're one of these people that is going to the toilet more than 3 hourly, then there's a few little tips and tricks. So next slide, please. So the first thing you do, you get that message that you need to go, and don't panic, stop and breathe. Okay, that's number one. Number two, do you know little girls when they're desperate to go to the loo? They do a little dance and they hold themselves and thinking, you need to go to the loo, and they don't. They're saying, no, I'm having far too much fun here. And what they're doing is they're using physiological techniques. What you want to do is to sit, cross your legs, or tap your feet. Or if you're standing, you can go up and down on your toes. The dermatonal level that you're stimulating will switch off that bladder contraction feeling. So you're using your body's own physiology. So it's quite, the children are doing automatically what we can do. They're really clever. The other thing you can do is, this is your bladder and this is the urethra, and you've got your pelvic floor around the bladder neck sphincter here. So when your pelvic floor is on, the bladder should be relaxed and just passively filling up. So you can do an active pelvic floor contraction, which will then send a message to the bladder to say, calm down, I'm on, you shouldn't be. So again, it's using a feedback loop to your bladder to calm it down. Okay? And finally, distraction. We all know we've had that message to go to the loo, and then you've got busy doing something, and it's not until an hour later that you need to go. So thinking about that can be quite useful as well. So pelvic floor exercises. Who does pelvic floor exercises? 10 out of 10. 10 out of 10. So the pelvic floor muscle lives right down here, and it works as part of a team with the deep tummy muscles, the diaphragm and multifidus. And if you go and see my colleague Charlotte, she is doing classes on Pilates here today, so you'll be taught how to use all of those muscles together. Okay, so when you're doing your pelvic floor muscles, if you sit up really nicely with a fabulous posture, then you are going to automatically be trying to engage these muscles. If you slump, stand like, then you are not going to be switching on those muscles. So think about standing or sitting really well before you do the muscle action. Okay, next please. So we need to work these muscles. We need power, endurance and timing. Okay, so power contractions. So first of all, let's have everybody sitting up really well. Wiggle around so that you can feel your perineum on the chair. Nobody else asked you to do this. Okay, now I want you to all think about your pelvic floor. Okay, I want you all to gently tighten around the back passage and then lift around the vagina, and then you're trying to pull that muscle up and forwards so that you close around the urethra and then relax. And in sitting, because you're all aware of your perineum, you should feel a gentle lift away from the chair. Is everybody feeling that? If you're not, you need to come and see me later. Okay. And relax. Know what the perineum is? The bit that you sit on. The bit that you're sitting on. So power contractions. The idea is that you do 10 of these 3 times a day. So that is a full lift and a full relax. A full lift and a full relax. And you can do them in different positions, but most of the time the biggest stress on our pelvic floor comes when we are standing. So if you can do the majority of your exercises actually in standing, so against gravity, you will get best effect. Okay, but it doesn't mean to say that if you're in the car driving somewhere, it's still a good idea to do a few then. When you get the opportunity, go for it. Endurance. This is a long, gentle hold. So are you all ready to have another go? So be aware. Okay, so pelvic floor lift, but just a half lift. And you're going to hold and breathe. Hold and breathe. Keep it going. Keep breathing, keep holding. Keep breathing, hold and breathe. Keep it going, and relax. That is a 10-second hold, and you need to be able to do 10 of those, holding each one for 10 breathing cycles. Okay, so it's quite a long time. Now the knack, this is the timing. So using the muscles at the right time is really important. So I've had some patients that have a great pelvic floor, a great hold, but then they don't use them when they cough or sneeze. So they're no use nor ornament really. So you're all going to have a go at a cough. So pelvic floor on, hold it on, now cough, and now relax. Okay, so that's worth practicing. So it's coughing, sneezing, laughing, lifting, pushing, pulling, everything that involves effort. You have an opportunity to leak if you're not using your pelvic floor. There's a fabulous app called the Squeezy app. I think it is £2.99, and you can download that onto your phone. So it will remind you to do your exercises, and there's loads of information on it. There's a fluid volume chart as well. So if any of you have the urgency issues, you can monitor what you're drinking and what your output is, and have a little look at that.
I often recommend the Squeezy app. It's brilliant.
It's fantastic, isn't it? Okay, so we don't want to see when you're doing your exercises, shoulders lifting, toes lifting, any funny faces, big bottom squeezes, okay? We want the underneath muscles to be working, okay? I didn't see any funny faces when you were doing them earlier, so you're obviously doing it very nicely. Okay, next one please. Now this is about number 2s. So we don't want people straining and pushing on the toilet, because if you have any symptoms of prolapse, that's going to make a prolapse worse. Okay, so going to the loo properly is something that I don't think anybody ever teaches us. So I'm going to use the chair. Men do this really well, by the way, going to the loo. They disappear off after breakfast and disappear for as long as it takes, don't they? And what we do is we get the message we need to go to the loo, and then we think, oh no, got to empty the dishwasher, make the packed lunches, clear the breakfast table, and that moment goes. So the stool's told you need to go, but then as you're doing all these other jobs, the stool moves back up and that message goes away. And then we might not go again till much later on in the day. During that time, more and more fluid is taken away from the stool. It becomes harder and much more difficult to pass. So lesson number 1 is listen to your body and go when your body says go. Number 2 is you need to sit, and you need your knees higher than your feet. And often the men have longer legs than us, so they automatically get themselves in a better position. So you might need some magazines to put your feet on, or the children's stool, or there is something called a squatty potty, but I really don't think you need to go out and buy one of these things that goes around. So your knees are higher than your feet, but you don't want to be on your tiptoes like that, but I'm just doing that for demo purposes, because you're not relaxed in that position. You lean forward, you relax your tummy, and you relax the pelvic floor, okay? And then you can just breathe, and you just give everything a chance to move. If things aren't moving in the right directions, you have to say, shh. And what that does is a very gentle pressure down on the intra-abdominal pressure to increase that intra-abdominal pressure, sorry. If that's not working, try and say idge. So you have to say idge with attitude, so it's idge. And if you all have a try, so that I'm not the only one looking silly. So all forward lean sitting. Okay, relax tummy, relax pelvic floor. Try saying shh. Can you feel what I mean? It's a very gentle pressure. Now let's have 2 idges each with attitude. Off you go.
Idge.
Come on, a bit more oomph than that. Fabulous. Okay, can you see what I mean? That you get a gentle pressure, but it's not a big heave-ho that we don't want, because we don't want to put pressure down on that pelvic floor complex, because we don't want to make any prolapses worse. Okay? So get up now. Okay.
Just under 5 minutes.
Okay. So why exercise? So actually this one's more about sexual activity. So estrogen, taken away from us through menopause, has a significant effect on the pelvic floor, well, on the vaginal tissues, sorry. Our vaginal tissues become much thinner and much more friable, which means that intercourse can become very uncomfortable, okay? True Brits do not talk about this, okay? But there is a lot that can be done to help. So you need to identify it first of all and notice that this is a problem for you. Okay, so there are quite a few things that you can do. Sorry, I ought to mention also that testosterone is also reduced, so libido can also be something that just disappears from our lives. Okay, so that, in association with discomfort, sex can often literally disappear from your relationship without you really noticing it. So there are lots and lots of things that you can do to help. So I think, can you have next slide, please? So pelvic floor exercises, first of all, they are going to help to plump up all of those muscles underneath. So you now all know how to do those. We want power 3 times a day, endurance 3 times a day, and remembering to do them at the right time. Okay. A prescription of Vagifem or estrogen cream. Now this is a form of HRT, but it's a very tiny dose, so it can be delivered locally to the pelvic, to the vaginal tissues. So it can be delivered either as a little tablet of, called Vagifem that you insert, or cream, which is sort of used in a plunger way. And it can make a massive difference to those tissues. Have you seen that as, with your patients?
I feel like everyone should have used that.
Yeah, I agree with you.
Yeah, it's very low risk.
I agree.
Works really well.
Avoid things like scented soaps and vaginal douching. Some people have this thing about everything's got to be very clean inside. Well, it's not good for the pH levels, so please don't do that. There are vaginal moisturisers which I think have varying levels of usefulness, but lubricant with intercourse is massively useful. The one that I particularly like is called Yes. You can get Yes water-based or Yes oil-based, and you can get samples from Yes. So if you Google them, and you can just try the two. They feel quite different, the water-based and the oil-based and the water-based. The oil-based is a bit thicker, and I think perhaps has a bit more slippability about it, but some people prefer the water-based. You shouldn't use the oil-based with condoms, so just to be aware. Pelvic floor relaxation. If you've had a lot of pain with intercourse, then we go into protection mode. You know, if you've got a sore elbow, you contract around it to protect it. Same with the knee. Well, it's exactly the same underneath with these pelvic floor muscles. Okay, so you've had really uncomfortable intercourse, your partner's getting a bit amorous, those pelvic floor muscles tighten up. Okay, so we need to learn how to relax them. So we all know how to work the pelvic floor muscle now. Now we need to think about the other end of the spectrum. So imagine that the pelvic floor is a little block of flats with 3 stories. We have second floor, first floor, ground floor, a basement and a wine cellar. Now we want that pelvic floor to end up in the wine cellar, clearly. So you're going to have a go at this as well. So everybody sit up nice and straight, a fabulous posture. So let's have a pelvic floor lift up to the top floor. Let it go down to the second floor, first floor, ground floor, down to the basement and down to the wine cellar. So it's a letting go, it's not a push. Okay, that's really important. A letting go, not a push. Okay, so it's all about learning.
What's the difference in the feeling between letting go and pushing down?
A push, you know when you want to do number 2s and things aren't moving in quite the right way, which is a big heave-ho, that's a push. Letting go is, it's a much softer feeling. It's a widening of your buttock cheeks, it's a widening around the vagina feeling, but it's not a push. Yeah, is that helpful? Does everybody understand that? And the other thing is communicate with your partner. Let them know how you're feeling, because they won't know unless you tell them. And you need an understanding partner. Okay. Next thing, please. Okay, so why exercise? Have I got about a minute left?
It's gone over now.
Oh, is it okay for me to?
1 minute. Yeah.
1 minute. Okay, so lack of estrogen has an impact on the heart, but it also has an impact on the bones, bone density. So I'd like to talk more about bone density. So weight-bearing exercise is really, really, really important for menopausal women. So swimming is not going to cut it, but we need weight-bearing, resisted exercises. So walking, maybe carrying 2 little weights, resisted with bands, really good. Exercise classes, perhaps not high impact, but you can do low impact with small weights. And we need, I think it's five 30-minute sessions a week, or you can do longer sessions. I think it's 150 minutes of exercise you should be aiming to do in a week. And it doesn't matter how you break that down, but exercise is key. So pelvic floor exercises and general exercises. So if we go on to...
Call it a day then.
Yes, that's fine. I think I'm there.
Yeah.
Pleasure. And I am around, and Charlotte's around and about as well, if you want to speak to any of us later.